Chapter 21, Radiology and Nuclear Medicine, the Language of Medical Imaging. So, Section 21.1, Production of X-ray Images. X-rays were first discovered in 1895 by Willem Conrad Roentgen. These X-rays, like light and radio waves, are a form of electromagnetic radiation. The characteristics of X-rays include velocity. Because they're electromagnetic, X-rays in a vacuum travel at the speed of light, 186,000 miles per second. This velocity is reduced as X-rays penetrate the different substances of the body according to their density. Wavelength. X-rays have a very short wavelength compared with other electromagnetic waveforms. Only gamma rays from an atomic explosion have shorter wavelengths. This wavelength is a major factor in enabling X-rays to pass through many materials and tissues to different degrees. Air is the most radiolucent and allows the greatest penetration. Photographic plates show black. Fat is denser than air, water is more dense, and bone is the most dense. So radiopaque. Photographic plates show white. Invisibility. X-rays cannot be detected by sight, sound, or touch, so health professionals working in radiology wear a film badge to detect and record radiation to which they're exposed. Ionization. An ion is an atom or a group of atoms carrying an electric charge by having gained or lost one or more electrons. When X-rays ionize matter, they can both kill cancer cells and damage normal cells to produce the side effects of radiation as well as genetic mutations that cause malignant changes. Radiation can also cause damage to a fetus, so the use of X-rays in pregnancy is kept to a minimum. Recording of X-ray images. Special type of photographic film is used to record X-ray pictures. The X-rays are converted into light, and the more energy that passes through body tissues to reach the photographic film or plate, the darker that region of film will be. Lungs will be dark. Bones that prevent the passage of energy will be white. X-rays can now be detected electronically using a recorder similar to that in a digital camera. This means that they can be read immediately and stored more easily. Electromagnetic, meaning pertaining to energy propagated through matter and space. Ion, an atom or a group of atoms having gained or lost one or more electrons. Ionization, the process of causing an atom or a group of atoms to gain or lose one or more electrons. Ionize is to cause the process of ionization. Radiolucent, penetrable by X-rays or other forms of radiation. Radiopaque, impenetrable to X-rays or other forms of radiation. Patient alignment. In many situations where X-ray images are taken, the X-ray tube that produces the radiation, the patient and the photographic film must be aligned to direct the X-ray beam to the lesion being examined in the best possible way. Radiologic technicians are responsible for placing patients in the proper position as ordered by a healthcare provider. Terms describing the direction of the projection of X-ray beams are the importance of the chest X-rays and are posterior anterior, in which X-rays travel from a posterior source to an anteriorly placed image receiver. This is the most common chest X-ray view. Anterior-posterior, AP, in which the X-ray travels from an anterior source to a posteriorly placed image receiver. Lateral view. In a left lateral view, X-rays travel from a source located to the right of a patient and travel to an image recorder to the left of the patient. This is reversed in a right lateral view. Okay, we have medial lateral oblique, MLO, which is commonly used in mammography. Craniocaudal, CC, head to foot, common used in mammography. Oblique, in which X-rays travel at an angle from the perpendicular plane and pass behind the heart and lung hilum to show structures normally hidden in PA and AP views. The terms anterior, posterior, and other directional terms are described in Chapter 3. Acquisition and radiologic images. Radiologists are physicians with specialized training in obtaining and interpreting medical images. Radiologists further specialize in acquisition of images, interventional radiology, nuclear medicine, and radiation therapy. Plane projectional radiography. Plane radiography was the only modality available in the first 50 years of radiology. The x-rays that pass through a patient's strike an undeveloped film held in a light-tight cassette. The film is then developed chemically to produce an image on the film. Now, digital radiography, DR, is replacing film screen radiography. X-rays strike a plate of sensors that convert the signals generated into digital information and an image on a computer screen because of its lower cost and availability. Plain radiography is the first-line examination of choice in radiographic diagnosis. Lead aprons can be used to protect patients and technicians from receiving unwanted radiation. Fluoroscopy, a continuous X-ray image is shown on a monitor like an X-ray movie. This allows real-time imaging of structures in motion, for example, blood vessels of the gastrointestinal tract. Radio contrast agents such as barium sulfate and iodine are administered orally, rectally, intravenously, or into an artery and enhance the real-time imaging of dynamic processes such as blood flow in arteries and veins. Angiography or peristalsis in the GI tract. Iodine contrast also may be concentrated in tumors, cysts, or inflamed areas to make them more opaque and conspicuous in imaging. Barium meal, also known as upper gastrointestinal series, enables radiographs of the esophagus, stomach, and duodenum. Is that hair in the face? Okay. And duodenum to be taken after barium sulfates ingested. However, the diagnostic use of a barium meal has declined with the increasing use of esophagogastroduodenoscopy, which allows direct visual inspection of suspicious areas in the esophagus, stomach, and duodenum. Angiography, radiography of blood vessels after injection of contrast material. Angiogram, the radiograph obtained by angiography, angioplasty, recanalization of a blood vessel by surgery. Arterioposterior, the direction of X-ray beam passes through the patient from from front to back. Fluoroscopy, Fluoroscopy, examination of the structures of the body by X-rays. Oblique, Latin for slanting. Slanting in radiology, a projection that is neither frontal nor lateral. Mediolateral, an angled side view of the structure. Mediolateral oblique, an angled side view of the structure. Opaque, impervious to light, impenetrable by X-rays or other forms of radiation. Posterior, anterior, the direction the X-ray beam passes through the patient from back to front. Radio contrast, agents that make structures stand out in X-ray imaging. Craniocaudal, a view of structure from head to foot. Mammography, X-ray imaging of the breast. Mammogram, the X-ray record produced by mammography. Radiograph, image made by exposure to X-rays. Radiographer, technologist who performs X-ray procedures. Radiographic, pertaining to X-rays. Radiology, the study of medical imaging. Radiologic, pertaining to radiology. Radiologist, specialist in radiology. Interventional radiology, IR uses minimal invasive procedures for both diagnostic purposes, example in the angiogram, and for treatment like angioplasty. X-ray images are used for guidance, and the basic instruments used are needles and catheters. The images provide a roadmap to enable the instruments to be guided to the areas containing diseases for diagnosis and for treatment. Benefits from these procedures include short recovery time, shortened hospital stays, reduced infection rates, and reduced costs. Computed tomography. The first commercially viable computed tomography CT scanner was produced at MEI Labs in England in 1972. MEI owned the rights to the Beatles' music, and their profits funded the research. CT scans used X-rays in conjunction with computer algorithms to produce a computer-generated cross-sectional image, tomogram, in the axial plane. From these images, the computer can reconstruct coronal and sagittal images. Radio contrast agents can be used with CT to enhance the delineation of anatomy. CT scans have become the test of choice in diagnosing some emergency conditions such as cerebral hemorrhage, pulmonary embolism, aortic dissection, and kidney stones, and in identifying small lung cancers. Unfortunately, CT scans expose the patient to much more ionizing radiation than does an X-ray. Here's the brain hemorrhage, colored computed tomography CT scan. The front of the brain is at the top, and a large mass of blood, hematoma purple, is seen at the upper left frontal lobe. Bleeding hemorrhage in the brain occurs when a blood vessel such as artery ruptures. It may be caused by a head injury, high blood pressure, or vascular disease. In this case, a tree fell on the patient's head. The area of the brain supplied by the ruptured artery may be The area of the brain supplied by the ruptured artery may die due to lack of oxygenated blood, leading to a stroke. Ultrasound. Medical ultrasonography uses ultrasound, high-frequency sound waves, functioning in real time to visualize soft tissue structures in the body. No ionizing radiation is involved. Because of this, it plays a vital role in obstetrics, enabling early diagnosis of fetal abnormalities and multiple gestations. Ultrasound measures the severity of peripheral vascular disease and evaluates the dynamic function of the heart valves, and major blood vessels. In trauma victims, it can also assess the integrity of the major viscera, including liver, spleen, and kidneys, and the presence of bleeding into the peritoneum. Magnetic resonance imaging, MRI, uses strong magnetic fields to align atomic nuclei in the tissues. When it uses a radio signal to disrupt the nuclei and observes the radio frequency signal as the nuclei return to their baseline states. MRI can produce images in axial, coronal, sagittal, and oblique planes, and also can give the best soft tissue contrast of all imaging modalities. It is an important tool in musculoskeletal radiology and neuroradiology. Its disadvantages are that the patient has to lie in a noisy, confined space or a tube for long periods of time, and it cannot be used for patients with pacemakers or any metallic implants such as artificial joints or implanted surgical hardware, implants, rods. For patients with claustrophobia, anti-anxiety medication can be prescribed to be taken before entering the scanner. Okay. Teleradiology involves the transmission of radiographic digital images from one location to another for interpretation by a radiologist. It can provide real-time emergency radiology services and expert consultation around the clock. I'm just remembering when I had to get a MRI for my knee when I severed my PCL, and then I partially tore my ACL, and what was it? What else? Just another tear, but it wasn't as bad, of my MCL, and I had a fractured knee. And I'm trying to lay there in that machine, and it hurt so bad to try to even straighten my leg, let alone I was being completely calm, and as still as I could, and it just was like still a fucked up picture, just because my leg being put into that straightened position and like strapped in was just like shaking. So the people who were taking the pictures were like irritated, like that I didn't stay still, and I'm like, I had no choice. I couldn't hold myself still if I wanted to. My legs just kind of fucking, my knee is blasted, bro. I was so swollen. Okay, axis. So a line of central support. Axial, adjective pertaining to an axis. Coronal, ventricle plane dividing the body into anterior and posterior portions. Fibroglandular, a mixture of fibrous and glandular tissue. Interventional, pertaining to an overt act to change an event or outcome. Sagittal, pertaining to the ventricle plane dividing the body into right and left portions. And teleradiology, the interpretation of digitized diagnostic images transmitted from a distance. Tomogram, a radiographic image of a selected section or slice of tissue. Tomography is a process taking a tomogram. Ultrasound, very high frequency sound waves. Ultrasonography, delineation of dynamic structures using sound waves.